Hi, this is my tips to pass the National Board of Dental Hygiene examination test. Actually, I have my dental board exam. I teach in the university and I have been tutoring for the dental hygiene boards for many years, so I can give you some tips on how to pass the exam. My first tip is to study wisely, which means don't study everything the same amount of time. And this will be based upon the structure of the exam. So here is the structure of the exam I have right now. It tells you the grades. So, as you know, or if you took the exam already, so you already know. If you didn't take it, the National Board of Dental Hygiene examination consists of 2 sections. Section 1 is 200 questions. Section 2, 150 questions. Let's see the content of each section to know which section and which area to focus on. Section 1 has 200 questions, as we mentioned, 30% scientific basis, 58% provision of dental hygiene services, 12% community health and research. What does it mean? Without even going into depths, it means provision of dental services, the most important, the most frequent question in the exam, and so on. Provision of dental hygiene services, which is 58% from section 1, include anything you provide in the dental office. This includes patient assessment, including taking history, clinical examination, asking for lab or special investigation, as for example radiographic examination. It also includes periodontology, everything related to periodontology. It's also related to prevention measures as like Fisher serums, fluoride, and all of this. So this is one thing. Other thing about provision is like treatment planning and infection control, patient with special needs, medical emergency. Think about it. The exam focus on things you usually will provide in the dental office. It's 58% of section 1 because you will do this stuff every day. Section 2, which is 150 case-based question, it's gonna be like from 12 to 15 cases based on, guess what? Based on the same we're talking about. These cases, like they give you scenario, and this scenario basically based on the same provision we talked about. It based on like X-ray interpretation, how to manage certain patient with certain disease, how to diagnose this periodontal condition, and so on. So that means part 2 or section 2 of the exam based on the topics related to provision of dental hygiene service. Not only, so it's like almost half the exam, like less than half the exam, and more than half of section 1 also depends on this area. So let's focus on patient assessment, periodontology, radiology, then medical conditions, because this is like, it's like half the exam and then more than half, so I guess it's between 60 to 70% of the exam are these topics related to perio and patient diseases. I'm not telling you not to study the other topics. So let's see, the other topic is, as we mentioned, section 1 has 30% scientific basis, 58% provision of dental hygiene service, which is the most important, and community health and research, 12%. If we talk about the scientific basis, which is physiology, anatomy, histology, biochemistry, micro, general and oral pathology, and pharma, they are 30% of section 1. All of them together. So for the anatomy, histology, pathology, don't study every single information. Focus on, especially for pathology, let me put this laptop, especially for oral pathology, focus about the common diseases like lichen planus, oral lichen planus. Focus about like oral abscess ulcer. They are common. You can encounter them in your dental office. Don't waste so much time trying to know everything about anatomy. Focus on the important things. Focus on important things in the head and neck area especially. Same goes to the other physiology and all the basic science. So for the basic science, focus on the important, the dental related, head and neck related, practical. If you find something very difficult, like you can skip it while studying. Don't skip everything. Like, don't take my words like in a wrong way. No, I'm not just saying like skip everything about anatomy, histology, pathology and all of this. I'm just saying don't want like spend the same time equally, study wisely. Like for periodontology, for example, we can't risk missing information about periodontology, about how we do periodontal treatment, how, like, what is the types of gingivitis, what are the types of gingivitis, difference between gingivectomy and gingivoplasty and stuff like this. So the first advice, I don't want to be like too long, first advice was to study wisely. Second advice is to take care and be prepared to the wording of the questions. Many students tell me, Hiba, we know the information, we know the scientific information, but we don't know the wording of the question. So go prepared to know some terms they're gonna put in most of the question, like know what is indication and contraindication. Indication means, okay, it's an indication, we can't treat this patient. Contraindication means this condition. Contra means against, so we can treat this patient. What does oral manifestation mean? It means this disease has oral features. What does dental implication means? It's like not all diseases have dental implication, dental consequences, dental precautions. What the term pathognomic? Pathognomic means it's a feature specific to this disease. It only happens with this disease. Know that, like the third tip. So yeah, let's make it separate. The third tip is to know the etymology. What does etymology? Etymology means the origin of the word. So most of the scientific words and scientific terminology coming from Latin, and if you speak Spanish, you're gonna know like most of the words make sense. For example, if we're doing bimanual examination, mano, as you know, in Spanish means, like, if you speak Spanish, it means hand. So when I say bimanual examination, it means I'm using my two hands, like for whatever examination. The word this, dys, it's not the word, it's a part of the word. This means difficult. So if you know it means difficult, it doesn't matter which areas they're gonna ask you, because you know dys means difficult. So it could be dysphagia, because phagia means phagocytosis, means eating. So it gonna, or means pharynx, related to whatever you want. So it means difficult swallowing. Know also in Latin, when we add a or in front of a word, it means without. So we have like anoxia, it's like no oxygen, and hypoxia, for example, means less oxygen, and so on. Last tip is to focus on the clinical application. While studying, ask yourself how this will benefit my patient, because most of the question related to the clinical application, like how can I diagnose the oral obstruction, the lymph nodes, how can I treat patients with this disease or this disease. Like, think about it as a case, not just separate information, and try to locate if this information is clinically applicable, if like you're gonna face it in the clinic, you're gonna work it. So most probably it's gonna be in the exam. So in the exams, they need you to graduate it as a dental hygienist, knowing how to treat the patients. So this were my tips on passing the National Board of Dental Hygiene examination. If you need more videos, feel free to tell me. Thank you.